Hi everyone, this is Kendra Hinnenkamp, and today I'm going to be presenting my master's project on the topic of macular degeneration. Throughout this presentation, we will talk about the general features, symptoms, physical exam, diagnosis, and treatment of macular degeneration. To start out, let's define macular degeneration. It is a progressive disease which involves deterioration of the central portion of the retina, which is also called the macula. Over time, this deterioration leads to a loss of central vision. Central vision is important for tasks such as driving and reading. When considering the importance of the topic of macular degeneration, we can look at the prevalence. It is the leading cause of blindness in the industrialized world, and over 11 million Americans are affected by the disease. As a healthcare provider, you will certainly encounter patients who are diagnosed with or presenting with the symptoms of macular degeneration. There are two types: dry, which is also called atrophic, and wet, which is also called neovascular. Dry macular degeneration is characterized by the accumulation of extracellular material on the retina. This extracellular material is called drusen bodies. They appear yellow under the ophthalmoscope. Wet macular degeneration is characterized by growth of new, unstable vasculature that can leak into the retina, which is called a subretinal hemorrhage. Dry macular degeneration may progress to wet macular degeneration, and wet macular degeneration is more likely to cause total vision loss. We'll now discuss the potential pathophysiology and risk factors for macular degeneration. While the pathophysiology of macular degeneration remains unclear, there are several contributing factors that have been studied and tested in clinical trials. It has been proven that VEGF, which is vascular endothelial growth factor, plays a large role in the neovascularization that occurs in wet macular degeneration. VEGF has been identified as a catalyst for angiogenesis. Furthermore, other studies have identified that anatomically thin subfoveal choroidal thickness of the eye predisposes individuals to the development of end-stage macular degeneration. Additionally, there are several risk factors for macular degeneration, including increased age, Caucasian race, a family history of macular degeneration, smoking, and cardiovascular comorbid conditions such as coronary artery disease. When looking at these risk factors, you can see that inflammation and ischemia play an important role in the development of macular degeneration. We will now talk about the symptoms and physical exam. Patients with macular degeneration frequently remain asymptomatic for many years. The most common presenting symptom is blurry vision. Patients might also complain of metamorphopsia, which is the bending of straight lines. Metamorphopsia is commonly identified through the use of an Amsler grid. I've included a picture of an Amsler grid on this slide. It is a 10 by 10 square that includes 400 boxes. You're to instruct patients to focus on the central dot and report abnormalities seen, such as bent or blurred lines. Other symptoms of macular degeneration may include scotomas, which are blind spots, and they might talk about having difficulty with reading, driving, or other activities of daily living. On physical exam, a primary care or ophthalmology healthcare provider can identify drusen deposits, patches of depigmentation, or areas of neovascularization on fundoscopic exam, which we will talk about more on the next slide. Typically, for the diagnosis of macular degeneration, a patient will present to their primary care provider complaining of blurred vision. On fundoscopic exam, the provider will see drusen bodies or neovascularization, depending on the category of macular degeneration, dry or wet. Primary care should refer these patients to ophthalmology, where a dilated eye exam with fundoscopy will be performed. On this slide, I have included two images which demonstrate the most common findings in patients with macular degeneration. The top picture shows drusen bodies, which are characteristic of dry macular degeneration. They are those yellow spots seen on the image. The second picture shows the neovascularization that's characteristic of wet macular degeneration, and there's a subretinal hemorrhage also on the image. Once the diagnosis has been established, there are more detailed imaging techniques available to help stage disease and direct further treatment. Particularly for wet macular degeneration, you can use fluorescein dye that can be injected into the retinal vessels and then conduct an angiogram. Newly formed aberrant vasculature will leak the fluorescein dye while normal vasculature will not, which can help to confirm or identify where neovascularization has occurred. Optical coherence tomography, OCT, can be used to provide cross-sectional images of the retina, which can allow providers to identify and stage the anatomic burden of the disease and direct further treatment. We will now discuss the treatment of macular degeneration. Antioxidants are the cornerstone for treatment of both wet and dry macular degeneration. Antioxidants work to fight oxidative ischemia, which leads to retinal ischemia and the development of drusen and patches of depigmentation. Therefore, antioxidants can help to reduce the progression of macular degeneration. Wet macular degeneration has further treatment options. As we discussed earlier, VEGF is a catalyst for angiogenesis. Therefore, VEGF inhibitors can be used and injected intravitreously every 2 to 8 weeks to help prevent or reverse angiogenesis. Photodynamic therapy, or PDT, can be used in patients who cannot tolerate VEGF inhibitors. PDT involves injecting a specific dye, which is called verteporfin, intravitreously, and then using a laser to activate free radicals which attack the new vasculature but do not affect normal vasculature. However, due to the need to repeat PDT frequently, VEGF inhibitors have largely replaced PDT and are used first line in the clinical setting. Lifestyle modifications play a large role in the treatment of macular degeneration. All patients should be counseled regarding smoking cessation, exercise, and a healthy diet rich in antioxidants to help reduce inflammation and ischemia. Furthermore, patients should be encouraged to participate in clinical trials in order to continue advancing the understanding of macular degeneration and work towards better treatment. This now concludes my presentation on macular degeneration. I hope that you have a better understanding of the symptoms, physical exam, general features, diagnosis, and treatment. On this slide, I have included my references. Thank you for listening and good luck on the quiz.